Hi guys, this is a lecture from spring of 2024. It's not week 7, it's week 6. Get this out of my way here. I'm using Camtasia. This is a new version of it, so I'm a little shaky with it, so bear with me. But yeah, we are starting the anatomy and physiology of the heart this week. And yeah, off we go. Here's our birds of the day. Red-tailed hawk. It's a Bullock oriole. There's a baby red-tailed hawk. Those are Morgan Hill birds. That's from this winter when the American white pelicans were around. So these are American white pelicans. And off we go, the heart. So the heart, of course, is probably the most vital organ in your body. You can't live without it for more than a few minutes. It's about the size of a fist, and it is the main pump that pumps blood throughout the body. It delivers its blood to every nook and cranny of the body via blood vessels, which we've studied intensively already. There's about 60,000 miles of blood vessels, if you can believe that the heart has to push blood through. Some fun facts. The average heart rate is about 80 beats per minute, but a baby's heart is around 125 beats per minute. A biological female's heart rate is about 8 beats faster on average compared to a biological male. In embryology, we'll learn that the heart cells that start to form the heart, they actually start beating at 4 weeks after conception. So that's quite amazing. Some fun facts about the amount of blood that the heart ejects. So it's about 1 quart of blood for every 10 beats. And in a day, on average, your heart pumps about 2,000 gallons of blood. That's amazing. Over a lifetime, an average is about 3 billion beats per lifetime. Maybe some not so fun facts. Why is the heart so important? Heart disease is the leading cause of death in the human. Period. End of statement. It doesn't matter what ethnic group you look at. Heart disease is the number one killer. 1 person dies every 37 seconds in the United States from heart disease-related complications. It's been the number one cause of death since the 1950s. Back in 2020, when the early forms of COVID-19 were around, SARS-CoV-2 was around, very, very deadly virus. So many people were dying, yet cardiovascular disease still claimed twice as many people than did COVID-19. This slide was on the test last quarter, I believe. So what are some risk factors for cardiovascular disease? Atherosclerosis, that is having a kind of a natural increase in the amount of low-density lipoproteins running around, which package cholesterol within them. So LDL and cholesterol levels elevation is not good. It leads to atherosclerosis. Hypertension or high blood pressure, diabetes, having too much sugar floating around your blood all the time can in and of itself lead to damage of the vessels. These are lectures all in and of themselves. Smoking, obesity, lack of exercise are all risk factors. What about the amount of blood that the heart actually pushes out? It's described in a word called stroke volume. So every beat of the heart, your ventricles will shoot blood. Like here's the right ventricle, we can see real nicely. And every beat of the heart or contraction of the heart, it squirts a glob of blood out. The left ventricle here squirts a glob of blood that comes underneath this pulmonary trunk here. The amount of blood that is shot out of the heart per beat is called stroke volume. And you can put that in fraction terms, and that would be called ejection fraction. And we'll get into those terms later in a couple weeks or so. Where is it found, just anatomically speaking? Well, it's in the thoracic cavity, not the abdominal cavity. It's a little bit left of the mid-sternal line, which you can see this dotted line right here. Just a smidge to the left, behind the sternum and ribs and costal cartilage, and it's found between the second and fifth intercostal space, if you want to get technical. And the heart is contained in a sac, a tough fibrous sac called the pericardium or pericardial sac. More exactly or precisely, where does the heart actually live? You can break the thoracic cavity or the chest cavity into two regions, kind of an upper chest cavity that is called the superior mediastinum, and then a lower chest cavity which has subcategories within it. That's the inferior mediastinum, and the heart lives in the middle component of the inferior mediastinum. There's an anterior mediastinum, a member of the inferior mediastinum, a middle, and a posterior subcategory, subcompartment within the inferior mediastinum. And in the middle mediastinum is where the heart and the pericardial sac lives. Great vessels also live in this compartment as well. Some nerves, vagus nerves, small blood vessels live there as well. Here's everything I just said, looking at the superior division of the superior mediastinum. Has no divisions, it's just one big space. And then the inferior mediastinum is here, from here to here. The diaphragm is the inferior border, and something kind of the outlet of the rib cage here in thoracic cavity. It's called the thoracic outlet, and that's the inferior border here. But you can see an anterior, middle, and posterior. We just talked about that. We'll get about the controversy here, thoracic inlet versus thoracic outlet, in a second. Actually, let's talk about it now. So the upper border of the superior aperture, superior thoracic aperture, if you will, or superior mediastinum, it is this superior thoracic aperture, also known as the thoracic inlet. I know you clinicians, wait a minute, that's the thoracic outlet. What about thoracic outlet syndrome? It's wrong. The clinicians misnamed it, and it stuck, and we can never get rid of it. But this is the thoracic inlet. Inferiorly, right down here, is the thoracic outlet. So clinicians, once again, are not on the same page as anatomists. So this hole in the upper thoracic cavity, that you could say that it connects the root of the neck with the superior thorax, or the thorax in general. It does form the upper border of the medium, or of the superior mediastinum. What are the boundaries? I do like boundaries. So what is the boundary of this hole right here, this thoracic inlet? So T1, vertebral body. It's kind of medial. Can't really see it that good in this drawing, but it's there. The first rib and its costal cartilage form the lateral and posterior lateral and anterior lateral boundaries of the superior thoracic outlet, or superior thoracic aperture, aka thoracic inlet. And then the manubrium forms the anterior and anteromedial boundary of the thoracic inlet. I would definitely know those boundaries. Even more importantly, perhaps, what structures pass through it? So we have the left common carotid artery. We have the brachiocephalic trunk. Note, the right common carotid artery does not pass through the thoracic inlet. The sympathetic chain and trunks do. The left and right brachiocephalic veins, which are here and here, and the trachea all pass through this thoracic inlet. So make sure you know that. Notice that there's some asymmetry here with regard to vessels. This is the aortic arch here. We have three vessels that come off: brachiocephalic trunk, the left common carotid, and the left subclavian. They all pass through the thoracic inlet. But where is the right common carotid? It branches off the brachiocephalic trunk, as does the right subclavian vein, and it's already passed out of the thoracic inlet, so therefore it does not pass through the thoracic outlet. Okay, another concept in this area. So if you took a knitting needle and you pushed it right between the manubrium and the body of the sternum and pushed it into the L4 disc, that has a name. That plane, which is perpendicular to the earth, has a name. It's called the thoracic plane, also called the plane of Ludwig, or the transthoracic plane, or the transverse line. Thoracic plane or plane of Ludwig is how I always learned it. It goes through the junction of the manubrium with the body of the sternum. That junction is called the manubrial sternal joint, also known as the sternal angle of Louis. Make sure you know that one. Okay, so what's this imaginary plane do? Well, it separates the superior from the inferior. The superior from the inferior mediastinums. We'll look at the sternum real quickly. Here's the body. You should have already had this in your osteology. Here's the manubrium. There's the xiphoid process. Right, there's where the manubrium meets the body of the sternum. That's called the manubrial sternal joint, or the sternal angle of Louis. This is always at the level of the anterior part of the second rib. In fact, clinically, that's how you find the second rib and then drop down in the second intercostal space, peristernal border, which is where your aortic auscultation area is and your pulmonic auscultation is. So that's an important landmark, that sternal that angle of Louis there. Also note the jugular notch right there is palpable. Xiphoid process. Careful with that. In older people, this joint can ossify and can be snapped very easily if you're doing rib adjustments and things like that, or doing CPR on somebody. Note that the body of the sternum has 4 segments called sternebrae, and there they are. Note that what attaches, this is a good board question, what ribs attach to the body of the sternum? Well, rib number 2 partially does. So rib number 2, 3, 4, 5, 6, and partial of rib number 7. So it's always good to know what attaches to the sternum. What attaches to the manubrium? Rib number 1 and part of rib number 2. So that's a good one to know. Definitely know who the true ribs are. It's ribs 1 through 7. Note that ribs 2 and 7, they don't have a full facet on their articular cartilage. They have 2 facets. Those are called demifacets. So that should be review from your spinal anatomy. And here's some more. True ribs 1 through 7, they directly connect to a vertebrae and the sternum. Ribs number 8 and 10 are called false ribs. They connect to the sternum via rib 7's costal cartilage. There's rib 7's costal cartilage right there. So we have a lot of ribs kind of joining that. The floating ribs which don't attach to the sternum at all are ribs 11 and ribs number 12. Rib number 12 can be very anomalous. Here it is down here, looking quite normal. But sometimes it's absent on one side and it's there on the other. Sometimes there'll be tiny, tiny little stubby things. So there can be all kinds of anomalies. Hypoplasty means the rib doesn't look like this. It looks like a little stub. So lots of different anomalies with that one. All right, what is the heart's basic job? Well, we know it's to pump blood to every nook and cranny of the body. Specifically, the left heart pumps oxygenated blood to all the tissue of the body. In a loop, you can call the systemic loop. It goes all the way up to the head, all the way down to the toes. It goes everywhere except to the lungs. The right heart's job pumps deoxygenated blood to the lungs. And that little loop can be called the pulmonary loop. Here's a cartoon of that. So here's the right heart, here's the left heart. So the right heart, specifically, it's the ventricles that really pump the blood out of the heart, but the right heart pumps blood into the lungs. And it also has to push blood through the lungs. That's a very important concept. And its job is to get the blood into the left atrium here. Okay. Once it's in the left atrium, it's pumped into the left ventricle and out of the heart, and it goes to the systemic loop, which is all over the body. Right heart has an easy job. Right heart is not very big and thick. Left heart is massive and muscular because it's evolved into a muscle, a very strong muscle. Okay, said this already, just kind of review. Heart has two different parts. It has the right heart and the left heart. Wimpy, super powerful. It has two chambers as well. The upper chambers here in this cartoon, these are called atria. Atrium is singular, atria is plural, and it has ventricles which are more inferior. In reality, this left atrium is pushed back into the plane of the page. That one's represents probably the most posterior structure. Okay, make sure you know how the blood flows through the heart. Comes in through the superior and inferior vena cava. There's no valve here. This is deoxygenated blood, and it dumps into the right heart. Excuse me. I'm not going to have time to edit that out. Sorry. Once the blood's in the right atrium, it goes into the right ventricle. Then the contraction occurs. It's shot up this thing. It's called the pulmonary trunk. Splits into pulmonary arteries. Even though it's deoxygenated blood, these are still called arteries because they move away from the heart. And then that goes into the lungs. They dump off their CO2 and pick up oxygen, come back via 4 pipes. These are called pulmonary veins, even though they contain oxygenated blood, because veins always return to the heart. Dump into the left atrium. They're pushed into the oxygenated blood's pushed into the left ventricle, shot up the ascending aorta, and around the horn here, this is the aortic arch, and it goes all over to every nook and cranny of the body. We'll learn more about the cardiac cycle. We'll get into that more in a bit. So kind of just said everything. But what are the structures blood is ejected into? Deoxygenated blood is injected into the pulmonary trunk. Oxygenated blood is ejected out of the left ventricle into the ascending aorta. Make sure you know those two members of the great vessels. Who are the great vessels? Anything that attaches to the heart is considered a great vessel. Superior vena cava, inferior vena cava, pulmonary trunk, and all 4 of these pulmonary arteries or veins. Well, they're bringing blood to the heart, so they're veins, even though it's oxygenated blood. So those are pulmonary veins. Those are the great vessels. Okay, everything I said. Don't need to go over it again. Just kind of a cartoon, though. Again, the right heart pumps deoxygenated blood into the lungs. Specifically, the pulmonary arteries get smaller and smaller and smaller until they become capillaries. The capillaries are surrounded by these little breathing balls, if you will. These are part of the tracheobronchial tree. These are called alveoli. And it doesn't show it here, but there's a nest of capillaries around here, and lymph vessels for that matter. And the CO2 is pushed out, and the oxygen that we breathe in is pushed onto red blood cells. So there's about 1 million of these alveoli in each lung, not just one of these things. Okay, there's some valves as the blood flows through. So we have these interchamber valves here. That's the tricuspid, try before you buy. Tricuspid, bicuspid. Tricuspid has 2 cusps, tricuspid has 3 cusps, bicuspid has 2 powerful cusps. Collectively, these are called the atrioventricular valves, or AV valves. Okay? When blood leaves the heart through these great vessels, pulmonary trunk, ascending aorta, passes through these 2 valves. Collectively, these are the semilunar valves. This one is called the pulmonary valve, and this one is called the aortic valve. So there's only 4 valves that you need to know, and that's everything that I just said. Great vessels, we already mentioned the great vessels, but there they are again. Superior vena cava, inferior vena cava, pulmonary trunk, ascending aorta, and then we have pulmonary veins coming back, 4 of them coming back to the left atrium. Those are the great vessels. Even though the pulmonary veins aren't like gigantic, but there's 2 of them, so cross-sectional area equals about the same as one of these giant ones, so they're still called great vessels. Okay, just another thing. We've already described this, so you can read through that yourself. We've already talked about that. Yep, already talked about this, how the blood comes in to the pulmonary arteries, and it gets into something called the alveoli here. The alveoli is a member of the respiratory unit. We'll look at that in a minute. But alveoli, there's 3 different small tubes that contain alveoli, and they all are part of this respiratory unit. Here's a picture of the respiratory unit right here. So there's 23 divisions of the tracheobronchial tree. We'll get into that more. You'll get into that in anatomy, reach 3 more. But they start out as big pipes, then they get smaller and smaller and smaller. And when you get down to these tiny tubes, they actually have these bumps where the alveoli are. So we have respiratory bronchioles, to have a few alveoli. Then we have alveolar ducts, which have a lot more alveoli. And then we have the alveolar sacs, which are just basically filled with sacs of alveoli. And you can see kind of a cool picture. We can see pulmonary vein pushing. That's actually taking blood back to the heart. This would be the pulmonary artery, which is bringing the deoxygenated blood. Gas exchange is occurring here. Deoxygenated blood turns red because now it's oxygenated, and now that's headed back toward the left ventricle there. Okay, everything we said already, you can read that. I like to repeat myself sometimes too much. Everything we've already said. When the blood comes out, the oxygenated blood blasts out of that ascending aorta there. The end of it, where it connects to the heart, that has a name. That can be called the root of the ascending aorta. And the root has 3 of these little dilations called coronary aortic sinuses. They're often just aortic sinuses. There's a right, left, and then there's a non-coronary aortic sinus, which does nothing. But the right and the left coronary sinuses, which would be right here and right here, they have the major blood supply to the heart muscle itself. These are the coronary arteries. So there's a right coronary artery and left coronary artery, which is short-lived. We'll look at how the coronary artery system a little later, but for now you need to know the heart is a muscle, it's tissue, it needs blood, and it gets the very first blood. The freshest blood of all goes to the heart itself, and it comes out through the right and left coronary artery. You can also see the valves here. The semilunar valves are all 3-cusped. They all have 3 cusps. This would be the aortic valve. I guess you could call it the left semilunar valve, but no one really does that, so just call it the aortic valve. Okay, the wall of the heart. I went over this in embryology just today because students always have such a hard time with the wall of the heart. So here's a heart. If we look at this wall right here, blow it up, it has 3 components. It doesn't seem so complex to me. It's got a bunch of endothelial cells, just like blood vessels, but here they're called endocardial cells. And they're the same thing. They just get a different name. And then we have the myocardium here. This is where all the muscle cells are. So very, very thick, very, very powerful. And then we have, this is the confusing layer right here. So the outermost layer of the heart wall, quote, wall, is called the epicardium. It's got an AKA that you have to know just as much as the word epicardium, because that's kind of easy. Like epi, like your epidermis, the skin, the outer part of the skin. Epicardium, the outer part of the heart wall. But the AKA is the visceral layer, or the visceral part of the serous pericardium. So there's a visceral and there's a parietal layer, just like the 3 P cavities we talked about. Right? This is one of the P cavities right here. So let's just leave it at that. So right now, endocardium, myocardium, epicardium, and now we get into the heart sac layers. So there's a space right here called the pericardial cavity that's filled with serous fluid. And then we get into this layer right here. This is the parietal division or parietal layer of that same serous pericardium. Why is it serous pericardium? Because it secretes serous fluid. That's what the blue stuff is here. And then the very outer layer of the heart sac or the pericardium is the fibrous pericardium. So my test question could say, if you stick a pin through the heart, through the sac of the heart and into the chambers, which one of the following is not one of the layers? Or all of the following are layers of the heart or pericardial sac, except what? So you definitely need to make a note card and train yourself what these layers are. And watch out for the AKA of epicardium. That's AKA is visceral layer of the serous pericardium. Okay? That's everything I said already. So it's a protective sac around the heart. Kind of weird that they just don't always call it the pericardial sac, but they don't. Sometimes it's just called pericardium. And yeah, it protects the heart. There's the 3 layers of the pericardial sac. Fibrous is the outer, serous pericardium, or serous, or you could say the parietal layer of the serous pericardium, and visceral layer of the serous pericardium. So everything we've talked about already. And yeah, the weird thing about that epicardium is, as you can see from this slide and that last slide, like the layers of the heart wall itself, that here's make a note card on this. The epicardium is the outer layer of the heart wall and the innermost layer of the pericardial sac. It serves double duty. Okay? I asked that question today in embryology. Not a single student could remember that. So very high yield board type question, so make sure you know that. The great vessels are also enclosed within the pericardium or the pericardial sac. It's like Ant-Man got in here and made a weld here and welded this together. If I pour water or blood, if we get a leak here and it's bleeding, the blood will not go inside the pericardial sac, which is a good thing. However, if we get a bleed at the root of these great vessels, then the blood will fill up the pericardial sac. Specifically, the pericardial cavity will fill with blood, and it'll start to crush the heart in a condition called cardiac tamponade. And I think we've talked about that already. But the same thing, just like blood coming from the outside can't get into the sac, blood that comes from within the sac can't get out, and it can crush the heart. Okay? Everything we talked about. Yeah, super clinically important. These serous, parietal and visceral serous pericardial cells secrete serous fluid, normally about 15 milliliters of the slippery fluid, and it fills up this space and it makes the heart slippery and it reduces friction when it's beating. There's cardiac tamponade, so we have maybe pericarditis where the serous pericardium is infected with bacteria. The immune system has spotted it and is attacking it. We have inflammatory juices spilling over in this pericardial cavity, and there's nowhere to go. The fluid can't get out, so it crushes the heart, so it can't fill with blood. And you get yourself a condition called cardiac tamponade. Very dangerous. This can kill you. You can go into hypovolemic shock because that crushes the heart. Hypovolemic shock. Because not enough blood fills the heart, not enough blood gets out of the heart. What can cause an irritation and what can cause these serous pericardial cells to oversecrete fluid? An infection with a virus or a bacteria. Cancer cells can get into the pericardial region here, into the pericardial cavity, and start growing and start causing an inflammation. And the cells can cause tamponade by themselves, but the immune system will attack those cells, and that causes inflammatory juice as well. You can get an autoimmune attack, where all of a sudden your body forgets who the visceral layer of the serous pericardium is and just starts attacking it for some unknown reason. It's thought those autoimmune attacks are thought to be from breakdown products of cigarette smoke, pollutants, and kidney disease. The end stages of kidney disease, your blood starts filling up with debris from the kidney breaking down, and they can get stuck in there, and the body sees them and attacks and does that. So that causes cardiac tamponade. And yeah, so what? The filling will crush the heart. So it's not so much the heart can't beat. It can beat just fine, but it can't relax, so it can't fill with blood. So your stroke volume, the amount of blood that is ejected out of the heart, gets smaller and smaller and smaller, and your blood pressure gets lower and lower and lower. And pretty soon your brain doesn't have enough oxygen because there's not enough blood around, and you pass out and die if that's not affected. That's called cardiogenic shock, because the heart is the problem. Everything I said, Myocardium, again, is the thickest part of the heart, mainly made of cardiac muscle cells called cardiomyocytes. They live between the epicardium and endocardium, you could say. Study tip: cardiac muscle, along with smooth muscle and skeletal muscle, you remember from histology, those are the three types of muscle fibers in the body. Yeah, it's way thicker than the other layers. It has the ability to contract in unison, which squeezes and decreases the volume of the ventricles and shoots blood out. Lub-dub, lub-dub. So some basic terms. When the heart contracts, that's called systole. That's also called the lub-dub, lub-dub. Specifically, that's ventricular systole, ventricular diastole, because there's an atrial systole and diastole as well we need to talk about. But when you see the word systole by itself, you just assume they're talking about the ventricles. So lub-dub, lub is systole, the start of systole, and the dub is the start of diastole. Make a note card on that and memorize that. What actually makes the noise, that lub? That lub has a name too. It's called the S1 heart sound. S1 heart sound. And that's made by the AV valves, the tricuspid and the bicuspid valves, slamming shut when these ventricles start to contract. We'll get into that more, but you might as well know that right now. Okay, that noise is the first heart sound, S1 heart sound, or lub. It marks the beginning of systole. We said that already. When the ventricles relax, these elastic giant arteries snap back and they push blood backwards, and these valves catch that blood and they snap shut. And that's the dub, or the S2 heart sound. S2 heart sound marks the beginning of diastole, or ventricular diastole, if you want to get specific. Okay, so S2 heart sound is the dub. It marks the beginning of diastole. It should be like a million stars here. Guarantee I'm asking these questions, so make sure you... And not only should you know this now, but if you don't understand this, you're good luck with the cardiac cycle, because I'm gearing us up to understand the dreaded cardiac cycle and then dreaded EKG. So got to know this stuff. I think I wanted to stop here. Yeah, let's call it. This is good enough. That's 50 slides. That's good enough for our makeup lecture today. All right, so I'll see you guys in class on Wednesday.